Scientists are calling this a medical breakthrough. A drug typically used to treat arthritis and fever can cut the risk of heart attacks. According to U.S. government information, heart disease accounts for 1 in 4 American deaths each year. New research suggests that the anti-inflammatory drug canakinumab can reduce the risk of a repeat heart attack by 15%. The research tracked 10,000 heart attack patients in 40 countries who were treated with the drug every 3 months over a period of 4 years. Canakinumab was shown to be more effective than statin, another drug heart disease patients usually take to lower cholesterol. The researchers also found some in the study, most notably the elderly and diabetics, contracted potentially fatal infections and sepsis. Experts say the drug could save lives, but some are wary of the side effects. Heart disease is one of the biggest killers worldwide. Keep watching for more on the latest research that's tackling it. Tick saliva could cure heart disease. Tick bites are annoying and sometimes dangerous as they may lead to serious illness. However, a new study shows that proteins found in tick saliva could also be used to treat a particular heart disease. Myocarditis is a disease that causes inflammation and damage of the heart muscle and typically affects young adults. When the heart becomes infected with a common virus, it releases chemicals called chemokines, which attract cells that cause inflammation. The heart muscle becomes dangerously inflamed, and patients with severe cases would need heart transplants. Tick saliva can contain up to 3,000 proteins, known as evasins, depending on their species. Evasins allow them to feed on blood without causing inflammation, thus making their bites almost unnoticeable. One evasin found in the cayenne tick can bind to and neutralize chemokines to prevent inflammation. This could also potentially prevent myocarditis disease. Although the development of adding the tick protein to actual drugs still has a long way to go, scientists believe this method could be used to cure heart disease, stroke, pancreatitis, and even arthritis. You might want to lay off the coconut oil. Health food enthusiasts and hipsters have long sworn by the many benefits of coconut oil. But according to the American Heart Association, it may not actually be all that good for you. Coconut oil, unlike most plant oils, is highly saturated. Its saturated fat content is 82%, higher than butter, beef fat, and pork lard. Saturated fat has been linked to low-density lipoprotein, which is bad cholesterol that can build up in the arteries and increase the risk of heart disease. The American Heart Association recommends eating less saturated fat, replacing them instead with unsaturated plant oils, nuts, and seeds. Still, coconut oil has been known to raise good cholesterol levels. And while the evidence doesn't say increased consumption leads directly to heart disease, the fact remains that it contains plenty of saturated fat. So as with all things, it may best be taken in moderation. Frank Sachs was the lead author of the report debunking the idea that coconut oil is a health food. While speaking to USA Today, his advice was, you can put it on your body, but don't put it in your body. A protein can trick your heart into thinking you exercise. Researchers in Canada have found a protein that can stimulate the heart to grow in a healthy way and pump more blood, similar to how it reacts during exercise and pregnancy. When a heart attack damages part of the heart muscle, the remaining muscle adapts by growing larger. However, this growth can cause dysfunction when the muscle fibers grow bigger without also growing extra blood vessels. A protein called cardiotrophin-1 can trick the heart into growing more blood vessels and form longer fibers. This could increase the heart's ability to pump more blood, similar to what it does in response to exercise and pregnancy. The researchers are hoping to test the protein in human patients. If the tests are successful, the treatment will become available in a number of years.